thanks for giving me all this honor. I really I appreciate that, but it's my honest desire to find colleagues to start treating these people. As Sandra mentioned, what I do and my few colleagues in Germany, it's not even a drop in the water, in the ocean. So we consider Germany has 1 to 2 million affected ladies. So if we treat 1,000, 2,000, so we don't even cover the increase of number of lipedema ladies. As you know, or you will probably know, there's a disease that only affects females. And females usually get kids, and some of the kids are girls, and some of these girls get lipedema too. So we are not even catching up with the increasing number. So we need plenty of surgeons who are willing to treat this insidious disease, and that's my purpose. That's why I'm here, and why I'm really honored to be here and to spend my time in Canada. It's just a pleasure for me, and speaking to you is just an honor. I want to give you just an overlook over my work I did over the last 22 years. I compile the information that you might carry on and pass it to your doctor, pass it to other friends or colleagues or other female where you think they might have lipedema too. So I live in a place, I live there where this guy has composed his worldwide known music, Richard Wagner, and every year around this time of the year there is a big festival which attracts people from all over the world, and with 3 weeks, around 3 weeks, the area is completely booked. And if you're a music lover, opera lover, and you want to hear Richard Wagner in Bayreuth, you have to book right now because it's booked for 7 years in advance. They have a longer waiting list than me, so I'm a bit jealous, yeah. This is what we're talking about today, is this kind of disease. Usually they see these people in the street. They are obviously slim, but there is something that doesn't fit to the rest of the body. And they have usually these large buttocks, and they have column-like legs. The legs don't have any shape, it's just heavy legs. And this is how the disease is described. This is this body appearance, what we're dealing with. What we know at this moment, it's not much. Really, it's much more unknown than we know about the lipedema. But we know a few things. It's always a symmetrical fat distribution disorder. It's almost only affects females. And the area that lipedema affects is thigh, buttocks, lower legs, and often the arms too. We have a big discussion, or not a big discussion, but there is some arguing going on if there are other places where lipedema occurs. I don't believe that. Our knowledge about how it develops, how it starts, why fatty tissue just decides to grow on the extremities and nowhere else, we don't know. We know there is something that must be related to estrogen, because when you ask the people when did it start, the big majority tells you it starts with puberty. Puberty in female means just a raise in estrogen. When you ask when did it get worse, it's often pregnancies. And even menopause is another issue that can contribute to the deterioration of lipedema. So we think it's estrogen related, and we think it's a polygenetic disease. We have family history. Many patients can tell you, my grandmother, my mother, my sister, or even you see a family coming into the office, mother, daughter, grandchild. So there must be some polygenetic reason for this. So we don't know why the hormone affects the fat cells and only fat cells in this area. We think that rather the fat cells hyperproliferate than just get bigger. And this also causes just a vicious circle. I will come back to this later. Very important for us to recognize and to accept that lipedema is not a special kind of obesity. Especially we doctors have to learn this. This is because we have to realize it does not respond to diet and sport, as Sandra has mentioned previously. One thing about lipedema is it's quite easy to diagnose. You don't need any technical equipment. You just need your eyes, your fingers, and you have to ask your patient. So it's very, very easy to get to a right and correct diagnosis. You ask about the family history. Is there anybody in your family has the same shape of your legs? You find the inspection. How is the fat distributed on your body? If you have a difference between your upper body and buttocks and legs, there is a high incidence that you have lipedema. We have this waist to hip ratio, which is in lipedema ladies always smaller than 0.7. You find this palpation when you look at, when you palpate, when you squeeze the fatty tissue by this patient, there is such a significant difference between the upper body, thigh, or arms. You feel this purple-like or styrofoam-like appearance findings. Pinch test is also very helpful, and I think it's even to do the examination, it's mandatory. Pinch test means you squeeze two different spots, for example, the abdomen and the thigh, and you ask the patient, where does it hurt more? Usually, a lipedema patient will tell you, just my thigh or my arm. When you do the same procedure with an obese people, they can't distinguish between the two places. You can have some additional technical investigations, but they are not really helpful. They just give you some idea about the amount of fatty tissue, how it is distributed. We don't have any specific lab results which indicates lipedema. What we find in many patients is the sedimentation rate of erythrocytes is increased, and many of these patients have a C-reactive protein, which indicates an inflammation, which is quite normal. When you look at the fatty tissue, the lipedema tissue is an inflammation tissue. It's an inflammation disease. One thing that's really very helpful, you have to examine the gait. You have to examine the axle of the legs, because these people have often very problems with the joints, especially with the knees, and this is caused by the lipedema. I will come back to this later. Ultrasound does help to establish the diagnosis, but it's not mandatory. You might complain how long it takes to find a doctor to diagnose you correctly. This is our figures. I did a study with my patient, with hundreds of my patients. They come consecutively in my office. It was 4 years ago, and they said it was a range between 4 and 30 years. So don't blame your doctors if you don't know about lipedema. It's just, it was the same in Germany 10 years ago. Mm-hmm. Meanwhile, we have risen to a level that almost every, be careful, but plenty of the doctors know meanwhile about lipedema. It's not a disease of nowadays. You find, if you travel to Egypt, you find on columns of all ancient temples, you find lipedema depicted quite clearly. It's definitely lipedema. Or you find this Bushman painting. It's a cave painting in South Africa. It's more than 3,400 years ago, and it depicts quite clearly a lipedema with slim upper body, huge buttocks, huge thighs and legs. So it has nothing to do with us processed food or too much sugar. It's just a disease. This is what lipedema is confused most, and this is the most embarrassing diagnosis you get, because if the doctor thinks you are just obese, he thinks you could do something against your disease. Just go on diet, exercise more, and it's really an embarrassing situation that your doctor doesn't believe you. He calls you a liar, and this happens every day in my office. My people, even with young girls, the mother joins the daughter with lipedema, and she tells me that the gynecologist, the general practitioner, they told the mother and the daughter, look, your daughter has something, she eats something additional. And it's not true. With the impedance analysis, we found out that most of our lippy ladies are undernourished. They live on 800 calories for years and years, and they gain weight with 800 calories. And this is true. So they don't lie, they just tell you the truth. And it's, as I said, obesity, to be confused with obesity, it's just an embarrassing thing. Lymphedema, literally, it cannot be confused. Lymphedema means you have it never symmetrical, hands and feet are with the primary lymphedema are affected. We get very profound information from Dr. Solas afterwards. Steatopedia is just a kind of fat pads around your buttock. And this is just an ethnic feature which you find especially in black people in Africa or in the United States. Obesity, heavy legs, that's quite sure, but the rest of the body is also here. So lymphedema, I get a lot of patients meanwhile referred to my office. We are now on the other side. So we overdiagnose lipedema. So we get plenty of obese ladies with heavy thighs diagnosed as lipedema. So we have to exclude lipedema rather to diagnose lipedema. So these ladies are typical for me. So they have just the same features around the belly and the thigh. So there is no way to diagnose a lipedema. It's just obesity. Lymphedema, as I said, is never symmetrical. This is steatopedia, slim upper body, normal legs, and most important, no pain. And as I said, the African guy, they think this is really sexy. Waist to hip ratio, we have all a waist to hip ratio. We men do, female do it as well. So we have a waist to hip ratio close to 1. So when you measure your waist to your hip, it's almost the same. You have this hourglass shaped body. So you have usually, to be beautiful, it's 0.75. That's the most admired figure for male. And in lipedema patients, they usually have it below 7. It means you have a small waist and a huge hip. It's measured circumferentially, which is wrong. Consider you are pregnant and you measure it circumferentially. You still have a huge belly, but the difference between your hip and your waist might just be the same. So it can be done only as a diameter to get a correct measurement. When you look at different countries, you have different stages. People tend to reorganize or just invent the wheel again. We have this since years. We define the type. The type means from the hip down to your saddlebags, it's 1, down to your knee, it's 2, and down to your ankle is type 3. It's quite easy to remember. And now the stages means, how does the tissue look? And I give you a few examples. So this is a type 1, just it ends here, and the tissue is almost close to normal, stage 1. You have a type 3, so it starts from your hip, you can see this down to your ankle. And when you look at the mattress-shaped surface and you see this bulging, so we have a stage 2. When we got any further, these people develop these skin flaps. And this is typical for now stage 3 and a skin flap type 3 and a stage 3. Like this. Late stages, and this is a lot of fibrotic tissue. This is scar tissue. This is developed over the years due to the inflammation. And as long as long as your treatment needs to be done, as long as more changes your normal fatty tissue to fibrotic tissue. On the fibrotic tissue, when it's really scar tissue, it cannot be removed anymore. That's the problem. But these are the typical feature. You see this slim upper body. It's a distinct difference between the upper body and the huge buttocks with a bulging fatty tissue here, and it's going down to the legs, to the ankles. The feet are usually free. No fatty tissue in this area. You have a smooth, really flat surface there. It's absolute normal. And you go down into this area which is affected by lipedema. You see the surface, it's rough. You have lumps and bumps, and it's a mattress-like appearance. Even in late stages, you always have this distinct difference between the upper body and the legs. And here you can see it's really column-like shaped legs. So the main feature about this disease is the disproportion and the skin texture, so it's really easy to diagnose. But one thing is crucial: your doctor must undress you. Otherwise, he won't see the difference between the slim upper body and your thigh and your buttocks. So if you don't get undressed with your doctor, you never get a proper diagnosis. Sometimes we mentioned this yesterday, it's a bit difficult for American patients to understand that they have to undress in front of the doctor. Wow. But so it's necessary, and believe me, your doctors did see naked women before, so yeah. Don't be shy. It's really crucial to get a decent diagnosis. Over the years, we noticed that there is no correlation between the severeness of lipedema and pain. So there is no, you can't just tell people because you have such a lipedema, you must have this amount of pain. It's not possible. There is no direct correlation. So again, what's wrong with this patient? It's 1 out of billions. So in the literature, there are just a few male described who have a genuine lipedema without having any hormonal changes. So it's an absolute normal guy. We investigated whatever was possible. He had normal hormones, he had normal sexual life. So he was just a normal guy, but he definitely had lipedema. And he was in agony like you girls are. So, but this is 1 out of a billion. So in the literature, maybe 5 or 6, and I'm likely to have one of them in my office. Unfortunately, like you will experience, it was not reimbursed. The operation for this guy was not reimbursed by the insurance companies, as well as even after fighting for more than 20 years, the German health insurance does not reimburse liposuctions, despite the fact with all these good results. So don't be disappointed if your health system is not covering the procedure now. We are going on fighting for you, and maybe in a couple of years we will be able to cover this with insurance. As I said, it's so easy to diagnose. You ask the patient, when did it start? And most of the big majority will tell you it starts right with puberty. My legs have changed, I gained weight, I stopped eating, I was on starvation diet, but nothing changed. We have another one, which is 7%, they start with pregnancy, but I have my doubts actually. In most of the cases, it becomes obvious that they have lipedema. Lipedema, and this, Sandra mentioned this, lipedema causes definitely obesity. It's a co-morbidity. So it's not the other way around. Because you are obese, you get lipedema. It's the other way around. Because you have lipedema, and because you have all this inflammation in your body, and because you have a deterioration in your mobility, you get obese. And there is also this psychological moment. People don't feel well in public. So, and you know, stress inhibits weight loss. If you have a stressful situation in your work, you never will lose weight. And these people they are in stress every day because they don't like their body, they hate their body, they get mortification every day in public, and so it's literally impossible for them to lose weight. Starvation that's quite normal. They starve for weeks and still gain weight. Most of them in early stages, when they develop lipedema, they are busy, they have a daily workout, they go bike riding, they are in a fitness, and still there's no change. And I feel sorry, because in my studio where everybody knows what I'm doing, and there is a new lady coming to this fitness studio, and I know exactly what the trainer is telling this young lady. I have a few exercises for you. You will see in 4 weeks' time. Your legs look slim and beautiful. And they are working, they have a workout every day, and they are really busy. And the problem is, after 4 weeks or after 6 weeks, they look down and they haven't changed a jot. So, but they don't blame the trainer, they blame themselves. So they say, oh, I did something, I didn't exercise enough, maybe I ate too much. They always blame themselves, and this is another thing which makes it really difficult to lose weight. When you have this kind of starvation diet and you're just being over years of asceticism, then all of a sudden you get frustrated and you just stop your lifestyle. Many of my patients have to stop because the knee joint are hurt, they can't do the sport anymore, and they start just normal eating, and the weight explodes. I like to ask my patient, what was your most significant insult situation where you have been insulted in public? It's really cruel. It's cruel what they tell you. The response is when they go to an ice cream parlor. People comment on this. I would go there if I had a figure like this. And so these daily mortifications, they sum up to really, you get depressed and you have a lot of problems with your psychological moment. And we have another reason, which is just lipedema causes a lot of fluid. Fat produces fluid, and this has to be carried by the lymph vessels. And because we have a certain amount of inflammation, we get some enzymes increased and decreased, and this leads as a vicious circle to more fatty tissue produced, and more fatty tissue produces again more fluid, and more fluid it's necessary to be carried by the lymph vessels. And this inflammation circle, it starts, and it's self-triggered, and we don't know where it starts and what the initial cause was, but it's a self-moving disease. It's quite easy to misdiagnose a patient like this as obesity. At the first look, this lady is obese. And if you have 220 kilograms, you have to be a certain obesity, there's no doubt. But if you look at these huge arms and about this huge buttocks, you look at the bra, this is my paradigm for this kind of disease. It doesn't cut into the skin, into the tissue. Wouldn't you expect, if she's really obese, that you would see the bra at all? No. It would be hidden in the soft tissue, but it's just no fat there. It's only the legs, the buttocks. To show you what I mean, this is an obese lady. You see the bra is almost, it disappears. This is obesity. When you go back to this is lipedema. It's a disproportion, a significant disproportion. She is distinct smaller up there than down to her leg. There is a few other fat distribution disorders. This is so-called Madelung disease. Just the fatty tissue is enlarged around shoulders and the upper arm. The odd thing about this is it's not painful, and it's just a cosmetic problem. It is a really cosmetic problem if you look as a female like this, so they don't like it. There is another fat distributing disorder. It's this buffalo hump. It's also a collection of fat, and this is a disease which also has an effect on the skeleton system because it causes some problem with the cervical spine. You have heard about this lipedema over the years, has so much fluid, so much overload that the lymphatics give up and it becomes a lipo-lymphedema. So lymphedema, we will hear this later on. You have the lymphatics are not capable to reduce the fat, the fluid. So it stuck there and it develops a protein high residue in this area. At the beginning, you have this fat calf here, and the foot or the feet just are normal. There's no fatty tissue here, no swelling. It just stops here. You see this? It's like a rubber band. It's this fat calf. And as long as we don't have an impairment on the lymph system, we have a stemmer sign negative. So this is important, but this indicates that you have already a significant lymph impairment. This is already what you can diagnose clinically. You see this when you do the ultrasound, you can see fluid, and you see also sclerosing substance, which is along the lymph vessels. In later stages, you find the fat layer increases, and now we try to probe just to test how much flexible is the fatty tissue so that we can get an idea how much we might get out with the liposuction. These are really late stages. You see a lot of fluid. All this is lymphatics, and this is severe lymphedema. So when lipedema becomes a lymphedema, you can see this here. It's quite clearly. You see the bulging of the foot. You see the toes are completely different now. And you have this skin fold around your toes. And this, I said for lymphedema, it's never symmetrical. With lipedema, it's always symmetrical. Otherwise, you have a primary lymphedema. You see, just symmetrical down from here. You have this fat calf still. Late stages, let's go ahead. You see the fat calf ends here, but you have this huge bulging lymphedema here. And it's even, the pressure is so high that the lymph fluid penetrates through the skin and just leaks out. This is what you call cellulitis. It's a bacterial infection, and it deteriorates the number, or it decreases the number of lymph vessels. So each infection increases the lymphedema. And late stages, they don't have heavy leaks anymore. It's all scar. This is like wood. When you palpate this, when you touch this, it's really like wood. And these are the late stages, and this is scar tissue. And here you had previously the cellulitis, which took place. You see also here, it's not fat anymore, it's not bulging anymore. It shrinks to a decent scar. It would be like cut here. Late stages, so we doctors, it's our responsibility not to let this happen. We should diagnose our patient, we should help our patient. My main focus is, as I'm in Germany the only surgeon in doing liposuction for lipedema, my other famous colleagues, they are all dermatologists. So this means they have more focus on lymphatics and more focus on skin. And as a surgeon, as I did hip and knee replacement, I was more focusing on knee and hip and ankle problems. That's the reason why I discovered a few things which helped my patient meanwhile a lot, that this lipedema causes severe back pain. We didn't realize this for years, but by coincidence, I removed this part of the fatty tissue, and the patient noted immediately that the back pain was gone. So meanwhile, we remove on each patient this part too, despite the fact, as you can note quite easily, it's not lipedema. Look at this tissue and look at this tissue. But it has such an effect on the spine that we remove this, despite the fact it's not lipedema. This is just this ankle. You see this? And when you just imagine this patient lying on her back, it would just straighten the hyperlordosis of her spine. And this causes so much pain that they can't lie on the back longer than a few seconds. Look at this sharp ankles, it's close to 90%. That's the reason why I always remove this part, and then you get a nicer ankle, and the back pain is gone immediately. Ask my patients, they will tell you this works properly. Another issue is the knee joints. Talk to people with lipedema, and I guess 80 to 90% will tell you they have some issues with the knee. And the cause is just this tiny little, at this moment, tiny little fatty bulge. So you see how these people stand. So they can't close the legs anymore, they can't put the ankles together. And when you put an arrow through the hip joint, through the knee, you see that it's not in the right line. This means this knee joint, which is a hinge joint, suffers most. The hip is just like a ball. So a difference in angle doesn't really bother the hip joint, but the knee joint is very prone to get osteoarthritis. And this is the reason for it. This is just the reason for this big fat bulge. People can't walk. Late stages, the legs are closed, but you see the difference, the distance between the legs. Even in very young age, you can get severe osteoarthritis like this, just not even 40 years. When you look at this, just the affected joints are the knees and the ankles. And this lady, she will not walk any longer than another 2 or 3 years, then she will sit in a wheelchair. And the cause is not an orthopedic reason, the cause is lipedema. And my colleagues usually tell me, yeah, you see, she is an obese lady. Of course she has a heavy weight, but she's a lipedema. You see the normal tissue here, you see the waist compared to the hip. So this is, we have to look at the patient as a whole, as totally. We can't just focus on the knee joints. Another issue which is connected with lipedema are this hypermobility or even Danler-Ellis syndromes are very, very, at least Corinne Herb thinks it's about 60%. I don't get to these figures, but a fair amount of my patients have this kind of hypermobility. And if we did a look at you, you could see, this is when you ask your stent, and then when you ask the patient to relax. She can bend her knee, just flex her knee in this direction, which is absolutely not normal, and it deteriorates the situation which lipedema ladies have with the malalignment plus hypermobility, and this causes very early knee problem. These people can just put down the flat palm on the ground without any effort. They can bend the elbow forward, and this is this kind of hypermobility which is often associated with lipedema. Gait disorder, I do studies with the gait, and we sent the patient from our area to a treadmill, and we record the pressure which they apply to the sole. This is a technical device that is just recording the pressure. And you see, this patient mainly walk over the ball of their feet. The whole pressure is just there. There's almost no pressure here. We can see this, the pressure, all the pressure is applied in front of the foot. This is the reason why they hang over, and when they walk, as we said yesterday, it's a bit like a penguin walk. You see, that's normal distribution only after a few days. You get a much better distribution of the pressure, and I show you how they walk. Look at the knees. They must really get, they are really prone to osteoarthritis. I show you a patient we did a couple of years ago. And we had this study done, we repeated this after 1 year. And this is the same patient. You see now the thigh gap is open, and we put them on, after 1 year on the treadmill again. This was the initial study. You see that all the pressure is on the ball of the foot, and after 1 year you have the pressure is evenly distributed. So there is no pressure on the knees anymore. There's no pressure on the ankles. It's just a normal appearance. So we can solve problems with the liposuction, which orthopedics cannot. Conservative diet, conservative treatment, I would suggest diet only with symptomatic obesity. Symptomatic means you have hypertension and you have diabetes. Otherwise, I'm not going to ask somebody to lose weight. They can't. And we discuss this often on panels when my colleagues just ask, just lose weight and come back if you're down, if you're below 100 kilograms. Because we tell them it's no chance that they all of a sudden start. They can't. They tried their whole life, so why should they all of a sudden lose weight? Complex physical decongestion, my colleague will talk about this intermittent pneumatic pump. He will talk about this in compression stockings also. So I wanted to show you another disorder which is common associated with lipedema. And you see we have eating disorders. Only 1/4 of all these patients I asked had normal eating habits. 3/4 of them had either anorexia, bulimia, binge eating, or they took just diuretics or something else. I tell you about something about the pain that afflicts people with lipedema. And it's such a severe, painful, insidious disease. You see, most of the patients are beyond 5, which means severe, very severe, unbearable. This is the group which suffers an almost everyday severe pain. And as I said, mental torment as well. You have what they suffer due to modifications. It's unbelievable high. It's hard, it's difficult to see, but you see a lot of scars here. This is what people do when they hate themselves. When they can't stand the arms anymore. You find this in legs as well. So we have to diagnose this patient very thoroughly, and we have to understand. The people cut themselves. They can't stand, they don't like them, they hate them, so they cut themselves. And this leads to this conclusion. Out of 100 patients they came consecutively in my office, 8 had done 1 or more suicide attempts. So this is really a serious disease, and I tell you what we can do against this. We do wall procedure. It's nothing else than high power water jet that rinses out the fatty tissue and leave back the lymph vessels. This is just normal. This is just fat. You cannot distinguish between lipedema fat and normal fat. You just take out whatever you can grab. I'll show you a few things. This is lipedema tissue. This is the same patient with a puncture done on the abdomen. You see, this is normal fat cells, large fat cells with thin walls. This is lipedema, the same patient taken from the legs. You see heavy fat walls. You see a lot of inflammation around the fat cells. So when you do the liposuction on this patient, you just take out the white stuff. And the remaining connective tissue is determined from what was there before you started with the liposuction. So it's not like a cosmetic procedure when you cannot do this in this area. So we would like to wish this, but it's not possible. I want to focus just on the legs, on the axis of the legs. For 2 weeks after the procedure, you look at the malalignment has disappeared completely. After 6 months, the thigh gap is open. The legs are straight like they should be. When you look at the knock knee here, it's just a half a year. So we can treat orthopedic problems with liposuction. This lady, look at this knock knee appearance. Look at this, how it looks now. And the disproportion is gone. But most important, they don't have knee issues anymore. We always take the same pictures. As soon as the thigh touches each other, then we take a picture. look the difference. This was 2015, and now she stands absolutely upright, and she has a normal leg axle. Very important to me is to understand that I can understand that people want to look more beautiful, but with lipedema we have limits. The tissue does not react like normal tissue. Look at this. She lost about almost 20 centimeters in diameter. And when she is dressed with trousers, she will look great. But when you look at the tissue, it's still a loose tissue. And it depends how old you are when we start with the liposuction. Look, even she has a thigh gap, but it's loose skin. And it cannot be improved any further unless you try to do what a lot of American surgeons do, is just to cut out skin, which is, in my opinion, something that shouldn't be done. First of all, you jeopardize your lymph system, and second, you have a huge big scar, which doesn't look nice actually. You see that the thigh gap is open and they stay straight, just straight. You see, most important in my office is just to get the leg straight, just to avoid any problems. And now one question: is it a candidate for liposuction?
No.
Yes.
No.
Yes. Look at this. Now you are clever. You're already educated. Look at this. She doesn't have fat here, but she has fat here. Not much, but it's different. There is a disproportion, a slight disproportion. And also you see every muscle fiber. You don't see any fiber on her legs. What happened? She became pregnant. She was a professional athlete. She became pregnant and her pain started. It was excruciating. She was in agony. And so she came to my office. Still not much. Still a nice figure, no doubt about it. But she was in agony. She couldn't do any sports anymore. This was after the liposuction, after half a year. And she was pain-free. The axle is okay, and no pain anymore. She could do her sport activities again. Long-term complications we have to face: obesity, according to lipedema. So lipo-lymphedema will appear after 15 to 20 years. We have this issue with the knees. We have this severe eating disorders. You have to keep in mind 40% of anorectic people die. 40%. If I have 16 out of 100, this means so we have at least 7 who could die from anorexia. So it's not just an appearance you have to cope with. It's a severe, insidious disease. Suicide attempts, we have to realize that these people are often quite susceptible or prone to suicides. And as I said earlier, they always think it's my fault. It's not their fault. It's just a huge fat disorder. I tell you about my apprentice. She came to my office. She started an apprenticeship, and we realized very early, according to her symptoms and how she changed, that she had lipedema. And if you have the right boss, he will offer you a liposuction. So look at this, it's 4 or 5 years later, and now she has got her first baby, and nothing has changed with her legs. She's still the same. So whenever people think about liposuction, do it always prior to your pregnancies. Don't just finish your family planning. You never can take back the time. First of all, you never can correct the changes that have been done during the pregnancy. And this is my non-tangible benefit. When I get pictures like this from my former patient, when they tell me she would never have expected to marry in a short skirt and feeling just like a normal person and being just happy and without pain and having no problems at all anymore. This is my non-tangible benefit. So I just come to the conclusion. So the liposuction is actually the only thing that can correct the malalignment and helps you with your knee joint. Even late stages, when your orthopedics tell you run bone to bone, because when you correct the inner inner side of your thigh. You changed the alignment. So you walk on the healthy cartilage you never have used before. So you might delay the knee replacement for years and years. So there is a good chance that your insurance company saves a lot of money because you don't need knee replacement, at least not for the next couple of years or 10 years. So, and you know, if you get a knee replacement very early, you might need a replacement of your knee replacement. Now this is really very expensive. It stops the progression. We think yes. We can't talk about cure, but we think even if pregnancy in a good liposuction does not change the legs at all, it's something very close to cure. And I have really plenty of young girls who become pregnant and got kids afterwards, and there was nothing unusual with them. Every normal lady has problems during the pregnancy, swelling, edema, and also the tissue changes. That's the reason why male don't want to get pregnant. So, and this avoids and reduces swelling, and it elevates the pain in more than 90%. It's an unbelievable number for an operation. Surgical procedures usually don't have such a high success rate. It restores the appearance to a certain degree. We can just harmonize the appearance, and most of them look quite good in trousers, but if you look at the skin and at the soft tissue, it's just a very weak tissue. More than 50% don't need compression stockings anymore, and in most of the cases it improves the quality of life really significantly. And this is my take-home message. Don't ask a patient like this, you should be on diet, and start with going for exercises, because she starved herself to death, almost to death. The boobs are gone, the rib cage is visible, and even the collarbones are visible, and the legs are still unchanged. Thank you for your attention, and spread the word about lipedema. Don't let you tell somebody that you are obese. It's just a disease you have to cope with, and just go out and spread the word about lipedema. Okay, then it was my mission was accomplished. Okay, thank you.
Thank you, Dr.